Hemorrhoids. Hemorrhoids, are conspicuous and bulging veins in the anus, and lower section of the rectum, which arise as a result of exertion during intestine work or as a result of significant strain on these veins, such as occurs during pregnancy. Hemorrhoids are a relatively common condition that affects roughly half of all individuals, even those over 50. After applying home remedies to treat hemorrhoids and changing their lifestyle, the majority of people notice an improvement in their hemorrhoid symptoms. Different types of hemorrhoids. Hemorrhoids are divided into 4 categories. Hemorrhoids on the outside. They are directly on the surface from where the stool emerges on the anus. They are not always apparent, however they sometimes appear as lumps on the anus surface. External hemorrhoids are typically not a major medical issue. Hemorrhoids inside the body. They are frequently found in the rectum and cannot always be seen from the anus because they are too deep. Internal hemorrhoids are normally harmless and disappear on their own. Hemorrhoids that have prolapsed. Internal hemorrhoids swell and adhere to the anus, resulting in prolapsed hemorrhoids. Outside the anus, prolapsed hemorrhoids appear as red, bloated lumps or pimples. Hemorrhoids that have thrombosed. A blood clot within the hemorrhoid tissue causes a thrombosed hemorrhoid, which can cause lumps or swelling around the anus. Internal and external hemorrhoids can potentially develop blood clots. Symptoms of hemorrhoids. Hemorrhoids have different symptoms depending on who you are and what type you have. 1. Hemorrhoid symptoms in general. The following symptoms may emerge in the case of hemorrhoids in general. No discomfort during bowel movements. You may observe a small amount of bright red blood on the toilet paper or in the toilet bowl from time to time. In the anus area, itching or inflammation. Discomfort or pain. Outside the anus, visible and bulging hemorrhoids. Inflammation of the anus. A lump at the anus that is unpleasant or extremely sensitive. Leakage of feces. 2. Different types of hemorrhoids have different symptoms. Hemorrhoids have distinct symptoms depending on where they are located. Internal hemorrhoid symptoms. Hemorrhoids in the rectum have no visible or palpable symptoms and rarely cause discomfort. When passing stool, however, straining or scorching the delicate outer surface of the hemorrhoid might cause bleeding. Internal hemorrhoids can sometimes flare out, especially when you exert yourself. Protruding hemorrhoids, also known as prolapsed hemorrhoids, can cause pain and irritation. External hemorrhoid symptoms. One of the most noticeable symptoms of hemorrhoids is irritation, which can result in itching or bleeding. A thrombus can occur when blood stretches the external hemorrhoid and draws it inward, causing extreme discomfort, edema, and inflammation. Hemorrhoids, causes and risk factors. Pressure causes the veins around the anus to constrict and swell, and swollen veins can occur as a result of too much pressure in the lower rectum. Hemorrhoids causes. Hemorrhoids can be caused by several things. The genetic component. Aging, as the rectal and anal veins supporting tissues weaken and contract with age. Factors that make you more susceptible to illness. One of the following reasons can cause hemorrhoids. Effort expended during bowel movements. Sitting on the toilet bowl for an extended period of time. Prolonged diarrhea or constipation. Overweight. Being pregnant. Sexual analgesia. Hemorrhoids complications. Complications are uncommon, although they can include the following. Anemia is caused by chronic blood loss as a result of sickness. Hemorrhoids get strangulated when the blood supply to them is cut off, causing them to suffocate, causing intense agony and finally tissue death, necrosis. Hemorrhoids diagnosis. The prognosis is different depending on the type of hemorrhoid. Hemorrhoids diagnosis. The doctor makes the following diagnosis. External hemorrhoids diagnosis. The proctologist can only see Diagnosis of primary internal hemorrhoids. The doctor must enter his finger into the rectum while wearing a rubber glove. Diagnosis of advanced internal hemorrhoids. The doctor examines the lower intestine and rectum by O. The aneuscope. O. The octoscope. Sigmoidoscope is a type of ophthalmoscope. Endoscopes are flexible, illuminated tubes that allow a doctor to examine the anus and rectum. Cases in which a colonoscopy is required. More extended and thorough examinations of all regions of the gut with a colonoscope may be required for diagnosis. In the following situations, a colonoscopy is required. Symptoms and symptoms in the digestive system indicate the existence of another disease, digestive system. There is a substantial chance that the person getting the examination will acquire large intestine cancer. The person being examined is over 50 years old and has not had a colonoscopy in the last 10 years. Hemorrhoids treatment. Treatments for hemorrhoids that work. Fortunately, there are numerous effective treatments available. The following are the many forms of hemorrhoids treatments. 1. Pharmaceuticals. Your doctor may give over-the-counter treatments such as creams, ointments, or suppositories if your hemorrhoids are simply making you uncomfortable. These drugs contain chemicals that briefly reduce pain and itching, such as hydrocortisone, and lidocaine. If you use an over-the-counter steroid cream for more than a week without consulting your doctor, you risk weakening the skin in the affected area. 2. Abolition. If an external hemorrhoid has caused painful clotting, your doctor will most likely remove the clot by performing a thrombectomy, which involves making an incision to drain the clot. If applied within 72 hours of the clot forming in the location, this procedure is highly effective. 3. Take simple steps. If you have bleeding and pain from your hemorrhoids, your doctor may recommend one of the following minimally invasive procedures, which can be performed in the doctor's office without the need for anesthesia. Using a rubber band to treat hemorrhoids. 1 or 2 rubber bands are placed around the base of the internal hemorrhoid to restrict blood from going to the hemorrhoid, causing it to fall out within 1 week. Bleeding may occur 2 to 4 days following the operation, but it is rarely severe. Sclerotherapy, sclerosing. The doctor injects a chemical solution into the hemorrhoid tissue to shrink it, and while this injection is painless, it may be less effective than a rubber band. Coagulation therapy for hemorrhoids. Lasers, heat, or infrared radiation are used in coagulation procedures to cause the internal hemorrhoid to harden and then wilt. When opposed to rubber band treatment, this approach has some negative effects and the risk of hemorrhoid recurrence is higher. 4. Surgical procedures. If the prior therapies have failed and the hemorrhoid is significant, the doctor may recommend one of the following surgeries. Hemorrhoidectomy. The surgeon eliminates the extra tissue that causes bleeding during this procedure. Local anesthetic with sedation may be used by the surgeon. This is the most effective method for entirely treating hemorrhoids. The procedure may result in urinary tract infections and trouble entirely emptying the bladder. Hemorrhoids become shorter. Only internal hemorrhoids are treated with this procedure, which seeks to block blood flow to the hemorrhoidal tissue. This operation causes less pain than the last one, but sadly, the odds of developing hemorrhoids again are increased. Bleeding, discomfort, and urine retention are all possible side effects of the procedure. 5. Hemorrhoids therapy at home. Home remedies for hemorrhoids that are not accompanied by severe pain include the following. Increase your fiber intake by eating more fruits, vegetables, and whole grains to soften your stools. Warm baths. 3 to 4 times a day, take a hot bath for 10 to 15 minutes. Keeping the anal area clean. Always use warm water to clean the anal area and its environs, and make sure to dry it well. Instead of using dry toilet paper, use moist toilet paper that is free of alcohol and scent. Applying a cold source to the area where the hemorrhoid appears to minimize swelling is a good idea. Other treatment options, depending on the type of hemorrhoids. Depending on the type of hemorrhoids, the doctor may use one of the following treatments. 1. Treatment for external hemorrhoids. Except in the case of thrombosis, there is no need or prescription for invasive procedures, or surgical operations for patients suffering with external hemorrhoids. Blood is frequently evacuated by a minor surgical operation, such as an opening, in individuals who are assessed within 72 hours of the thrombosis occurring, to greatly improve discomfort. On the other hand, some doctors and experts in this field believe that removing the hemorrhoids surgically is preferable to preventing the thrombosis from returning. 2. Internal hemorrhoids surgical therapy. If various treatments fail to treat the hemorrhoids or do not produce the desired outcomes, or if the hemorrhoids are large, your doctor will most likely recommend surgery. Some procedures can be performed in an outpatient setting, while others require a one-night hospital stay, such as hemorrhoidectomy with a closed incision, hemorrhoidectomy, open, stapling hemorrhoidectomy, Doppler ultrasound-guided closure of the hemorrhoidal artery, internal sphincterotomy on the side, prevention of hemorrhoids. Doc. It is preferable to follow the following steps in order to prevent or treat hemorrhoid symptoms. Consume dietary fiber-rich meals. Drink plenty of water. Considering the consumption of dietary fiber as a food additive. Avoid putting in a strong effort. Using the restroom as soon as you sense the urge. Participating in sports. Avoid standing or sitting for extended periods of time. Alternative medicine. Herbs cannot be used to treat hemorrhoids, although some plants and other natural compounds can help relieve hemorrhoid symptoms. The most common are honey, virgin coconut oil, gel from cactus, vinegar made from apple cider, tea tree essential oil.